the nursing degree program, it's extremely important to introduce innovative learning strategies in nursing education. Innovative learning strategies, the e-learning is promoted in higher education settings as a way of to promote more flexible approaches to learning. In the literature, the literature shows that innovative learning methods are gaining popularity as an alternative way of delivering clinical skills in nursing students. The educators must research the training strategies that can be adopted in the training of nursing students and the evidence in the literature on the impact that a remote platform can have on the skills and knowledge of nursing students. But little attention has been given to identify appropriate teaching and learning strategies that will effectively facilitate the development of the skills in nurses. One approach may be a learning and interactive teaching environment where tutors act as facilitator and students take on active roles. Among the innovative learning strategies in literature, we find blended learning and flipped learning. Blended learning is a mixed learning model when the activities performed in the classroom combined with other activities performed independently by the students. Flipped learning is a learning model that completely overturns the learning process. The lessons are held independently by the students, and the hours spent in the classroom are used only for exercising in the presence of the teacher. The benefits of this methodology is that it is possible to personalize the lessons. It allows the student to train students for the next lessons to be held in the classroom. The teacher can know in real time the number of access to the platform by the students. It is possible to reduce traditional lessons in the classroom. Sono andata avanti. Sorry. The disadvantages of this methodology are digital divide and the possibility for the students to procrastinate their study. Literature shows that safe administration of drugs is a central theme for all organizations. Errors in calculating the pharmacological dosage are often the cause of adverse events, associated with a percentage of about 11 to 14% of total therapeutic errors. Literature shows that students are very poor in math skills. Literature study, o perlomeno sì, teacher and research in all countries study this phenomenon by 50 years. University must play a fundamental role in training of students, and they can become professional with adequate skills to manage drug safely. Also, there is not international agreement on how to teach and develop skills in drug dosage calculation or on how to evaluate these skills. Nurses need adequate medication calculation skills to provide safe and effective drug administration and management, which is an important component of nursing profession. To perform drug dosage calculation effectively, nursing students need to acquire 3 skills: basic mathematics, conceptualize clinical information, and identifying the data that will allow the problem to be formulated and solved through mathematical calculations. The ability to construct a mental image of the units of measurements needed to perform drug dosage calculations. We focus our attention on the preparation of phase. These are the difficulties of the students in math. So, how can an innovative training strategy be more effective than a traditional training strategy? The research hypothesis is that a blended training strategy that considers multiple training strategies integrating in e-learning mode could arouse curiosity and interest in the students, enhancing students' empowerment and developing interactive and dynamic learning. The aim of this project is to test an innovative training strategies that aims to help students overcome difficulties in math calculation and make sure the drug preparation and administration process with a view to patient safety. Therefore, we designed and built a training course, and the pilot study has been implemented to identify the strengths and the weaknesses related to the proposed training strategies. In the first year nursing degree, we introduced a blended path composed by traditional lessons, abbinated to e-learning lessons, composed by basic math course, calculation exercise, laboratory in the years, in the entire course. In the second year nursing degree program, to the traditional lessons constituted by pharmacology, nursing, workshop, laboratory, we added the e-learning lessons constituted by advanced mathematical course, exercises on dosage drug calculation, including in real clinical cases. Students cannot access to the successive exercises if it haven't concluded the previous exercises correctly. The aim of this pilot study was to evaluate if an e-learning training platform is able to generate an improvement of knowledge and the skills in the subject enrolled. The study design was a quasi-experimental study with pre- and post-test. The study population were 9 third-year undergraduate students at the end of their program, before the degree, and 6 nurses, practitioners with professional experience of less than 5 years. This is the pilot study we implemented. The pretest was composed by 30 items, problems, with all the type of calculations that students and nurse made in clinical setting. After the pretest, students have access to the educational pathway constituted by theoretical module and video module. The video clip shot in neonatal intensive care when the students find drug calculation exercises with real pharmacological prescriptions. These are some of theoretical module students made in the path. The post-test was the same in terms of complexity of the pretest. Then the participants were invited to evaluate the training path. This table shows the descriptive frequencies between pretest and post-test, and we can see that the minimum score in pretest was 60 points, and in the post-test was 21. And the maximum score was 29 in the pretest and 30 in post-test. The total accesses to the video were 162, and each participant performed 2.16 accesses to each video. We can see the results stratified by category. The students shows the lower score than nurses, but also nurses, also one nurses completed the test with 30, 30, 30. Most of nurses made some errors. In clinical practice, this is not right, correct. The participants highlight the properties that distinguish the blended learning from traditional training: the immediacy, the simplicity of use, the accessibility to the platform, the clarity of the training material, the possibility of being able to exercise both with calculation exercises and the execution of the procedure in total autonomy with assumption of responsibility. We can see some aspects reported by the participant in their response. Students can measure their knowledge, the clarity of questions and the explanations, the type of exercises which have never been trivial, the immediacy, the ability to exercise on the calculation and other exercises. This can see the positive aspects, flexibility, reproducibility, and autonomy. These are the nursing student perceptions. The word of the participant, where, example, give me the opportunity to perform the calculation in peace without the tutor who stresses me. I felt like he was remembering more information than I would have done while attending a lesson. I realized my difficulties. I like learning independently, and this has allowed me to manage my time. Students and nurses have made access in afternoon, evening, and night time. This is different from those provided from traditional lessons. This shows that this way of teaching allows students to make additional material available to study and deepen in their free time, stimulating the students' sense of responsibility for their learning. Several themes emerged from the answer of the participants were related to the possibility of self-evaluation and measure one's competencies to have a greater awareness of oneself and of one's cultural baggage. The study participant evaluated the course as a whole with a score of 4.5 out of a possible 5 points. These scores demonstrates that this teaching method has achieved an excellent degree of consensus among both students and professional nurses. These results coincide with those reported in other studies. The flexibility of these tools gives the possibility to access resources and the most convenient times. This feature was found to be very welcome, as being an interactive tool gives the possibility to study the content whenever it is considered appropriate. Students and nurses have made access in afternoon, evening, and night time different from those provided. Study limitation of our study are lower number of participants, voluntary participation, impossibility to insert a timer in our platform. We hope to implement this course, this strategy in a whole degree program in the first, in the second, and the third year, the next academic year in our university. The implementation of this blending training path is associated or is oriented to the Bologna process, when not only the theoretical knowledge, but this knowledge will be transferred in the clinical context to solve the problem-solving based learning. This educational path covered integrated teaching strategies and innovative drug calculation methodologies which have been described to improve psychomotor skill and build cognitive abilities through the greater understanding of math linked to clinical practice. Our study shows that clinical skill workshops may be tailored to include teaching strategies that encourage the development of drug dosage calculation skills, and that training strategies implemented during a clinical skills path can enhance students' comprehension of mathematical calculations.